is Bryoni. What's your name? Wonderful. No, I've been expecting you. Please do just make yourself comfortable. Can you tell me what you've been experiencing? Okay, no, that's fine. I don't think it's anything to be worried about, but I will just give you a check over. Okay. So, is it more your face, your jaw? Okay. Alright, no worries. First of all, I'm just going to pop some gloves on, and then I am just going to come closer, just examine your face, your skin, just make sure that it's okay. Alright? Wonderful. Okay, I'm just going to come a little bit closer. Okay, I'm just gonna have a little look at your face, and I may just feel around. Okay, so just stay looking at me. Just turn your head the other way. Turn your head the other way. Okay. Alright, I just want you just to do this. Okay. Let's again. And again. Okay. Did that hurt at all? Alright. I'm now just going to feel your face. Okay. Any pain or discomfort? No. Alright. What I want you to do now is just do some movements for me. Okay. So first of all, just move your head from the side to the middle, to the side, to the middle, side, middle, side, middle, and then up and down, up and down, then the side and the middle, the side and the middle, and up and down, up and down. Good. How does that make you feel? Any dizziness? Any pain? Okay. Alright. Now we're just going to do some facial movements. So do a big smile for me. Bigger. Bigger, 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 bigger. Now do a frown. More. Good. Can you wink? And the other side. Now just puff your cheeks. Good. Puff your cheeks. I'm just going to put a little bit of pressure. Puff your cheeks. A little bit of pressure. Good. Now can you do this? Very good. Okay. Just stick your tongue out and move it from side to side, side to side. Good. Okay. Alright. I'm just going to massage your face a little bit, okay? Just let me know if there's any pain or discomfort. Alright, I'm just going to touch your face. Let me know if it's sensitive, okay? Good. Good. I'm just going to scratch the skin. Let me know how it feels. Perfect. I'm just going to use a light. I just want to examine your skin, okay? You can either close your eyes or just look directly at me, but don't look at the light. just going to look in your mouth. So just open wide. Okay. Oh, okay. It's a little bit red and inflamed. Okay. Right. Okay, to lift your tongue and move your tongue from side to side. Yeah. Okay. Can you just open your mouth wide? Go. Okay. Now just do this. And again. I think for you, you need to have a dentist appointment. Yeah, and just have a little look into your mouth. Okay? I don't think it's anything to do with your facial nerve and movement, but I think it might be more here, and it might be sort of your gums that's causing that. Yeah. So I definitely recommend having a full dental check. Okay. Alright. However, I'm just going to do a full sort of facial nerve check anyway, just to be sure. So this one requires just a little scrape on your skin, and I want to see how your skin reacts. Okay? So I'm just going to scrape, 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 lovely. And now I'm just going to use this little brush, and I'm just checking how well your skin reacts, okay? So just a little brush, 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 perfect. And now this one, it's a lot lighter, a bit like a feather. Okay, and it might tickle a little bit. So this one's a lot softer, but I just want to see how your skin reacts, okay? So just might tickle, 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 Hello there. How are you? Okay. No worries. My name is Bryoni. Please do just take a seat and make yourself comfortable. I can see you have something up with your eye. Don't worry, I won't touch it directly. What happened to your eye? Okay. Yeah, I think it needs a good clean. It's very red. Yeah. Looks like you've got something in there. Perhaps a little bit of dust or something. Okay. And do you know how it came about? Okay. Alright, no worries. You don't need to work yourself up. It's nothing to worry about. I can get that all cleaned up for you, okay? Wonderful. Do just sit back and try to relax, okay? Alright. I'm just going to get some gloves. That's better. Now I do want to have just a little feel around, okay? But do let me know if it's sensitive or painful, okay? I won't touch it directly, I just want to feel around the area, okay? How was that for you? Okay. Well, I got a few things to clean it, okay? And then I do just want to check your eyes, make sure they're okay. Alright. So I'm just going to pop these drops on first of all. Okay. You can just keep it open a little bit. And one more. Are you ready? Just close your eye for me. Good. Just let that soak in. Okay. Next I've got just a wipe. Just want to wipe your eye. It might be due to dust, hay fever, something might have got in there, so I just want to wipe it. But that should just soak into your eye and help to get away any infection if there is any. And this is good just to clean around your eye and your lashes. Okay? Is that dried? Okay. Going to clean your eye. How's that? Should be quite soothing for you. Okay. Just gonna tap, 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 tap. Alright. Just gonna wait for that to dry. Good, I can see that's already looking a bit better. Now, I'm just going to use a little bit of this just to drip into your eye, okay? Now, what I will get you to do is take some of these home with you. Just in a box like this, it's just saline, but it will just clean your eyes, and I think it will help. You can use it in both, but mainly this one. I'm going to take this off. Alright. So, yeah, are you ready? It's okay? Okay. Good. Alright, just keep blinking. Blink, blink, blink. I'm just gonna let that settle in. Good. Just let that dry. Wonderful. How does your eye feel now? Good. Alright. Well, I'm now just going to check your eyes, check your vision. Just want to make sure they're okay. Alright. So just look here. Look here. Look here. Look here. And look here. Okay. Can you look at the gloves? Look at the light. Look at my mouth. Look at my hair. Look at my shoulder. Look at my hand. Look at my hand. Look at my eye. Look at my ear. Look at my mouth. Look at the light. Look at the gloves. Look over here. Look over here. Look at my mouth. Look at my nose. Look at my hair. Look at my shoulder. Look over here. Look up here. Look over here. Look at the light. Look at the gloves. Look over here. Look here. Look here. Look at my mouth. Look at my eye. Look at my ear. Look here. Very good. Just look at my finger and keep following my finger. Follow my finger. Follow my finger. Keep following my finger. Good. Tell me when you can see my fingers. Good. 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 Tell me when you can't see them. Good. 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 Excellent. How many fingers am I holding up? How many? 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 Wonderful. Your eyes are looking good. Just stare straight at me. Just want to look. Yeah, your eyes look fine. What I'd like you to do is just focus on this. Okay? Just follow it for me. Focus on this bit. Just focus. Good. Wonderful. You can blink. 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 Now I'd like you to look at this pen. It's purple. Now just follow the pen. Follow the pen. Follow the pen. Wonderful. You can blink. 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 Now I'm going to use a light. Could you just look here? Look here. Look here. Look here. Look here. Okay. Just follow the light. Follow the light. Follow the light. Keep following the light. blink. I'm now going to look into your eye. Just look over here for me. Do not look at the light. Look at my hand. Do not look at the light. Okay. Do not look at the light. Look at my hand. Look at my hand. Do not look at the light. Okay, look over here, look at my hand, do not look at the light. Do not look at the light. Do not look at the light. Look at my hand. This is eye hand. Okay. This is sensitive to the light. Okay. Alright, no, that's fine. I'm going to try this one. Is this sensitive? Or is this fine? Okay. Look at my hand. Okay. Could you just look up for me? Keep looking up. Okay, look down. Okay, look left. Okay, look right. Okay, look up again for me. Look up. Okay, that's fine. You can blink, blink, blink. How do your eyes feel? Yeah, that's expected, especially this one. It is a little bit sensitive. I have cleaned it and it's just a tiny little bit red. I don't think it's anything to be concerned about. Just keep an eye on it. Like I said, I'll give you some of these to take with you. Okay. You can get them on the way out. But generally your eyes have responded well. I think it's important for you to keep your eyes clean, hydrated, don't let them get dried out, and just keep an eye on what it is that might be causing that to happen. You might have a hay fever, or like I said, a bit of dust or something might have got in your eye, but generally I think it's absolutely fine and you have nothing to worry about, okay? Now I would like you to come back to me if you develop any blurred vision, double vision, any watering coming out or discharge, just anything that's a bit unusual, okay? Wonderful. Well, it was so lovely to see you. Take care, and I'm sure you'll be fine. Bye-bye. hello there. Please do come on. Make yourself comfortable. My name is Bryoni. What's your name? Oh, it's so lovely to meet you. Can you tell me a little bit about what's been going on or what brings you in today? Okay, no problem. So just a general check, just to make sure everything's okay. Alright, no worries at all. So, regarding your face, do you have any sort of sensitive spots, sensitive areas that I need to be aware of? Or any allergies or anything like that? Okay, no worries. I won't be using anything harsh on your skin, so you don't need to worry about that. Okay, I am just going to pop on some gloves. Do just make yourself comfortable, okay? Okay, so to begin with, I'm just going to have a look at your face and your skin. I just want to make sure everything's okay. Alright, just visually. I just want to check. Okay. Alright. Are you happy for me just to have a little feel around of your face? Okay. If you have any pain or discomfort, do let me know. Okay. Okay, how's that? Any pain or discomfort? Any sensitive spots? Okay, it generally feels fine, looks fine. You have a couple of dry patches, but I don't think there's anything to be concerned about. Most of us have some dry patches, dry skin. It's absolutely fine. You can just get sort of a moisturizer to just calm that down. There's no eczema or anything like that, and there's nothing that I'm concerned about. What I am going to do now, I'm just going to use just one finger and I'm just going to rub, okay? You just tell me if it's sensitive, if it hurts, anything at all, okay? Good. I'm now going to touch, just prod, okay? I'm going to put a bit more pressure on, so you just tell me how that generally feels, okay? Shouldn't hurt though, alright? How's that? Good. I'm now just going to put some pain, just some pressure here. You might feel the pain, but I am going to push, okay? I want to try and stimulate, just to see what it feels like, okay? So I'm just going to push. I am quite pushing there. How does it feel? Does it make you feel dizzy? Headache? Migraine? Does it make you feel nauseous or sick? Ready? So I'm just going to push. I'm just going to try and pop some pain. How's that? No pain? No, that's a good thing. Wonderful. Okay, no, that's great. Okay, what I'm going to do, I'm just going to pop on some of this oil. Okay. Now, you'll be absolutely fine for your skin. I just want to try and put that just in a couple of those dry spots. And then I'm just going to be using a couple of tools just to feel around. It just makes it not itch or hurt as much when I'm doing that, okay? So yeah, I'm just going to pop a few drops on. Okay, I'm just going to... And then I'm just going to pop some on my hands. Lovely. Just so that I can rub that into your face. Just going to rub. Get a little bit of a massage as well. Perfect. Okay, I'm just going to use a little brush. It's very gentle, but do just tell me how it feels, okay? Mainly if it hurts, if it itches, that kind of thing. I just want to have a little look at some different spots, okay? Ready? Perfect. Now I am going to use a couple of these tools. First one I'm going to use is this pink one. Okay, again it's Okay, so just let me know how that feels. It might itch. How's that one? Okay. And now this one, I'm just going to sort of sweep it. So you just let me know how that feels. It's very gentle. I can brush. Okay, good. And now I'm just going to sort of scrape a little bit, okay? So I'm just gonna scrape it, How's that for you? Good. Okay. Next, I'm just going to use a light, okay? I just want to have a look at some of your moles and freckles that you have. I just want to make sure they're okay and that I'm not concerned. Generally, if your face looks fine, it's responding well. Okay, so I just have to check this. So you can close your eyes if you like, or just look straight ahead of me, but do not look at the light, okay? It's going to be bright. So I'm just going to look at your skin, okay? I'm going to use a brighter light. Again, don't look at it. Just want to look in a bit more detail. Yeah, that's okay. They look fine. Not concerned at all. Yeah, your face is wasn't too bright for you. Okay, well, what I'm just going to do now, I just want to check your facial nerve, okay? So just copy me, alright? I want you just to do this with your hands and just really move your face. Just move your cheeks like this, just move everything. That's it, copy me. Can I try? Yeah, that's all fine. Now what I want you to do, I want you just to move your head from side to side and up and down. I'm just going to feel that while you do that. Perfect. Can you do a really big smile for me? Lift your eyebrows. Okay. Do a frown. Good. Can you puff your cheeks? Good. Can you bring them in? Good. Can you wink? Wink, wink, wink. Perfect. Alright. Well, your face looks absolutely fine. Your facial nerves are fine. Your skin is generally okay. A little bit of some dry patches, but the oils really helped. Just moisturize that when you can. Okay, your moles and freckles are absolutely fine. There's nothing to be concerned about. Alright? Well, everything looks good. I'm happy. Please do come back to see me if anything changes, okay? Alright, well, do take care. Bye-bye. Oh, hello there. Please do come on in and take a seat for me. My name is Bryoni. What's your name? Oh yes, right on time. Okay, and just before we begin, just confirm your date of birth for me. Perfect. So can you tell me a little bit about what's been happening, what you've been experiencing, what brings you here today? Okay, so it's your eyes. Okay. Okay, so it's more like a routine checkup, more than anything. Okay. Now, is there anything that's been bothering you? Anything that's been happening regarding your eyes? Or any noticeable sort of changes? Any changes with your vision or anything? Okay, alright, that's fine. Have you been experiencing any blurred vision, double vision, any watering from the eyes, redness? Okay, and anything at all that you're generally concerned about? Okay. Alright, well, it seems like it's just going to be a little routine check for you. Okay? Wonderful. So, do just make yourself comfortable. Okay? So, I'm just going to put on some gloves. Is it alright if I just come a bit closer? Just have a look at your eyes. Wonderful. Okay. So I'm just having a look. Just look straight at me. Alright. Now is it okay if I just have a little feel under your eyes? And around. If you have any pain or discomfort, please do let me know. Alright, they generally do look okay. What I would like you to do, could you just look it? Look it. 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 Good, now just look it. Okay. 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 Very good. Okay. How many fingers am I holding up? How many? How many? How many? Good. 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 Okay, just look it. Look it. Okay, now just blink. 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 Okay, just look at my hair. Look over here. Look at my mouth. Look over here. Look at the light. Look at my nose. Look here. Look at my hair. Look here. Look at my ear. Look at my mouth. Look here. Look here. Look at my mouth. Look at my ear. Look here. Look here. Look here. Look at my mouth. Look at my ear. Very good. Okay. How do your eyes feel? Do they feel okay? Okay. I'm generally quite happy with the way they're looking. What I'm going to do though, I am going to just keep them a little clean. Okay. This is just routine for me to just clean around the eyes just to make sure there's nothing in your lashes and just to check that they're definitely clean. So, I'm just going to use this cleansing wipe. Don't worry, it won't hurt. Just going to wipe. Okay, on the other side. Okay, I'm just going to Okay, Okay, just close your eyes. Close your eyes for me. I'm just gonna very good. That should feel a bit refreshed. We'll just let that dry. That should be nice and dry now. What I'm going to do, I'm just going to use a light, okay? So first of all, I want to just have a look into your eyes. Do not look at the light. Do not look at the light. Do not look at the light. Look over here. Do not look at the light. Okay, look over here. Do not look at the light. Okay. On the other side, look over here. Do not look at the light. Could you just look up for me? Keep looking up. Okay, look down. Can you look that way? Look the other way. Okay, look that way. And look the other way. Okay, look up. Okay, look down. Okay, just blink. Blink. Okay, just look over here. Your eyes look fine. Okay. This side. Good. Okay, just blink, blink. I'm just gonna try something. I just want to see how well your eyes respond. Okay. Okay. Just come a bit closer. Okay. On this side. Very good. You can blink if you need to. Now just look at the light. 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 Okay. Now just follow the light. Follow the light. Follow the light. Just follow the light. blink, blink, blink. Okay. Next, I want you just to look at this blue pen. Okay. Now I want you to just look at it when you see it. Okay. Look at it. Good. 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 Very good. Now I want you to follow it, okay? Follow the pen. Follow the pen. Very good. Okay. I now would like you to just read the side chart for me. Try your best, okay? What's this one? Good. This one. This one. Good. This one. Good. What about this one? Good. Okay. Now the next one is to really test you. What about this one? Well done. Can you do this one? Okay. And this one. Well done. You did really, really good there. It's good that you've tried. So I have a lens here. And I just want you to tell me if it's clear with or without the lens, okay? Just want to see whether or not you may need a thorough eye check and perhaps some glasses, okay? So ready? This is without. This is with. So is it clear without? Or with? Without? Or with? What do you think? Again? Okay. So without? With? Without? Is it about the same? Interesting. Okay. Well, I think your vision is absolutely fine. You have perfect vision. What I am going to do, I'm just going to pump some drips into your eyes. They're looking a little bit dry, and these will just help them, okay? They may have just dried out just from your concentration. So we'll pop a few drops in your eyes and that should help you out. So I'm just going to drop this side, drop. Just blink, just hold it there. Hold it, hold it, hold it. Very good. Well, your eyes do look absolutely fine. They look fine to me. Your vision is great. They responded well. Little bit dry, but that's expected with all of these tests. Okay? And you've been concentrating a lot. I'm generally quite happy. Okay, if you did want to have a thorough eye check to see whether you need glasses, please do come back, okay? But it will be a much longer appointment. Yeah. Alright, well that is all for today. Thank you so much for visiting. It's lovely seeing you. Bye-bye. Oh, hello there. My name's Bryoni. Please do just make yourself comfortable. Don't worry, everything is going to be okay. You look like you've hit your head or something. What happened exactly? Okay. Alright, I'm just going to make some notes. And when did that happen? Okay. Alright. And how do you feel at the moment? Okay. Alright. Have you got any changes to your vision or anything at all? You don't see any sort of black sort of dots? Okay. And what about your balance? You feel okay? You don't feel wobbly? Alright. And how do you generally feel now? Okay. Do you have a migraine or a headache? Alright. Okay. Well, I am just going to do a little check. Okay. You generally seem fine. I will just put a little dressing on there for you, but I think it will heal okay. And then I just want to check a few things just to make sure you're safe, okay? And then I think for you the best thing will be to get some rest. How does that sound? Wonderful. So do you have any pre-existing medical conditions that I need to know about? Okay. Have you had any previous surgeries? Okay. Do you have any allergies? Okay. Alright. Well, I have everything that I need. Okay. Please do just relax where you are. Okay. I'm just going to put some gloves on, and then I'm just going to put a dressing on, like I said, and then I'm just going to check a few things just to make sure you're okay. Alright? Wonderful. Just going to pop these gloves on. Okay. I'm just going to have a little feel around of your head. I just want to check your bump there, okay? Do let me know if it's really, really painful. Okay. Alright, how's that for you? Good. First of all, I'm just going to clean the area. This is a wound cleansing wipe. It's alcohol free and it's very kind to the skin, okay? Clean that. It's only tiny. I'm just going to okay. I've just got my first aid kit here. I'm just gonna have a little look what I've got that will help you. It's only small, it's not a very big cut. Perhaps just a plaster will do. You definitely don't need a bandage. I think for you, just this plaster will fit perfectly. Okay. Just gonna pop this plaster on for you. Just gonna check that stride. Okay. put your plaster on. I'm just going to make a note that I just cleaned the wound and put the uterus in. It's just a plaster. Okay, that should be enough. Alright. What I would like to do now, I'm just going to do just a general check of you. Okay, so first thing I would like you to do is just look at this pen, okay? I'm just going to pop the light on. There we go. So, if you can, I just want you to look at the light. So when you see it, just look at the light. Good. 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 See, look at the light. Look at the light. Good. Look at the light. Good. Okay, now just look over here for me. Do not look at the light. Okay. Look over here. Do not look at the light. Okay, look over here, do not look at the light. Alright, now just look at the light and follow the light. Follow the light. Follow the light. Good. Follow the light. Follow the light. Keep following the light. Well done. Very good. You can blink. Blink for me. Okay. Now look here. Look here. Look here. Okay, look at my finger. 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 How many fingers do you see? How many? How many? How many? How many? How many? How many? Good. Good. Very good. Can you just follow my finger? Follow my finger. Following my finger. Good, you can blink, 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 blink. Okay, I'm just going to ask you some basic questions and just answer them, okay? They might seem a little bit silly. So, what year are we in? Good. And what day of the week is it right now? Good. Can you name me a vegetable? Any vegetable. Good. Can you name me an animal? start small, beginning with S. Perfect. And finally, can you tell me what my name is? Can you remember? It's Bryoni. Okay. Next, I'd like you just to read this eye chart for me. Okay. Can you tell me what letter this is? Good. How about this one? Good. This one? This one? This one? How about this one? Can you do this one? And finally, this one. Wow, you've got very good vision. What color is this? And what color is this? Perfect. Now I'd like you just to smell this. Just tell me what it smells like. Deep breath in. Good. What does that smell like to you? Wonderful. And just tell me what this one tastes like. So just pop your tongue out. What does that taste like? Perfect. I'm just going to have a little look in your nose, okay? So, just look up slightly. Can you just do this for me? Perfect. Okay, now just open your mouth and just go ah. Okay, good. That looks fine. Wonderful. Okay, so what I'm going to do, I'm just going to have a little feel around of your face. Okay, so just want to feel here. Can you just do this for me? Very good. Okay, I'm just going to feel your shoulders and your arms. Any pain or discomfort? Okay, I'm just going to bend your arm. Good, on the side. Just going to bend your arm. Okay. Now, I'm just going to check your breathing. Do you just take a nice deep breath in for me? Good, and out. Take a nice deep breath in. And out. Lovely. Okay, I'm just going to pop this here. I'm just going to listen to your chest. Okay. And this side, just under here. And now here. Okay, I'm just gonna put this here. And here. Okay. Your breathing is absolutely fine. Okay. Now, I just want to check your movements. So could you just for me move your head from side to side? That's it. And up and down. Good. Can you just smile? Frown? Can you puff your cheeks? Good. Just stick your tongue out. Perfect. Can you just do this? Can you do this? Can you do this? Move your hands down. Very good. Okay. You can relax now. Alright. Well, everything looks absolutely fine. I'm not concerned at all. Okay? Regarding your head, just keep that dressing on and then you can take it off. If you feel like you need to put another one on tomorrow, you can, but that should be enough and it should heal nicely. Okay? And if you do feel funny again and it happens, please do come back, okay, and get yourself checked over. Alright? But for now, you're absolutely fine. Take care. Please drink lots of water, keep yourself hydrated, and have a good night's sleep. Alright. You're welcome. Bye-bye.